Go.
Hello, my name is Brian Hardman. I am a nurse practitioner that works out of Parkersburg, West Virginia through the Counseling House. Um, I was asked to come on today to talk to you guys about depression. I'm going to talk to you about what depression means, some of the neurotransmitters that we try to treat with depression, uh, the class medications to try to say what you should watch out for this medication if it's in this class versus this class. And then we're going to touch on some other areas too, new treatment option called TMS, and then therapy as well. I would like to start off by talking to you about the SSRI class called serotonin medications. There's selective serotonin reuptake inhibitors. Those would be the typical ones: Prozac, Zoloft, Lexapro, Celexa, these kind of medications. As a class, they tend to help more with depression, certain anxieties. Generalized anxiety tends to be a good one, social anxiety as well, but they cause adverse effects that can include nausea and vomiting. And Zoloft in particular can make you feel what's called flat. So you won't be happy or sad. You feel blah, like you're just kind of there going through the motions. Serotonin, the way it plays in our brain, it helps with our emotions, moods, our instincts, our temperature control. So when we try to treat serotonin, these are some of the things that I want you to think about when they tell you that this is an SSRI. To try to have you remember or think about all the medications is hard. The main thing is I want you to know why you're taking it, what we're trying to treat, and then from there you can ask good educated questions on what should this medicine be doing for me? What should I be seeing improvement with this medicine? But know why you're taking it. Don't just take something without knowing. I have too many people come in that say, well, this is what they give me, and I ask them why they're taking it, and they don't know. They don't know if it's for depression. They don't know if it's for anxiety. Serotonin, the SSRIs, are used a lot for depression, anxiety, and can be for sleep regulation. They help regulate your appetite and your body temperature. There can be imbalances with your serotonin, and it can cause behavioral disturbances. So we try to use serotonin medications too to help regulate outburst, mood stabilization in kids who are very young. There's also things that serotonin can help with in your body. In your head, it can help with satisfaction. It can help you be more social, more interactive. It can help decrease migraines. They help when your serotonin is off. They can cause headaches, cause issues with agitation and confusion. Serotonin, a lot of people don't realize, has a lot to play with like your platelet count. It can affect whether or not you clot as well as you need to. It's part of our clotting cascade. So if we are too depleted in serotonin, we may not clot as well. Also affects your GI motility. So whether or not you're using the bathroom correctly, they can affect if you're nauseous. They can cause you to have hyperthermia, hypertonia, where you don't have a lot of muscle tone and maybe some muscle weakness, sweating, and tachycardia or a fast heart rate. So again, some of the medications that are in the serotonin class include Zoloft, Celexa, Lexapro, Paxil. Prozac is the oldest one out there. It's one of the ones people know the best. The next class I'd like to talk to you about is the SNRIs, selective norepinephrine reuptake inhibitors. There's only a few in this class that would be Effexor, Cymbalta, and Pristiq. These medicines are a little harder to come off of. They cause a little bit more withdrawal effects when we miss them. I personally had an experience with coming off one of them, and it was not very fun. So I try to use these a little more cautiously with people that don't take a lot of medications regularly or have a problem with compliance and maybe will miss a dose here or there. But they still can be excellent medications for PTSD, generalized anxiety. There's even more recent research that Effexor is very good for fibromyalgia or nerve pain, and Cymbalta has already been used for that for several years now. Norepinephrine is part of our fight or flight system. So to help you understand that would be, I always like to use the analogy of like if a polar bear comes at you, are you going to get up and run or stay and fight? Well, if a polar bear is coming at me, I'm going to run. So my body, norepinephrine in your body will help dilate your pupils so that you can see better, helps increase your heart rate so that you can pump, get blood going so that you can run away. It prepares you for the incoming battle or incoming threat, but it also can make you very, very nervous. One of the easiest ways that you can tell if your norepinephrine is raised is your pupils. If your pupils are really dilated, so really large, that is something we cannot control, but norepinephrine plays a part in that. And it is an easy way to kind of tell if somebody is a little more anxious than what they tell you, is to quickly look and see the size of their pupils. It is very common in panic attacks for people to express symptoms of my heart beating really fast. I get really short of breath. I feel like I'm losing control, or I can't control my thoughts. They feel like they are very sick sometimes. Their stomach hurts a lot. The norepinephrine in our brains helps with arousal, helps with attention, anxiety, and our alertness. The used a lot to treat, like I said, anxiety, depression, and also ADHD. There's versions of norepinephrine medications that aren't used for depression always, that can help control our norepinephrine levels to help decrease anxiety, but also increase the racing thoughts that our brain has, to help us sleep at night, to help us relax or detense more. Because when your norepinephrine levels pick up, you get those racing thoughts, you get the anxiety, you get the muscle tension, like I feel like I just can't relax. So there's medications that we use that involve norepinephrine that will push those levels down, and you get the exact opposite effects. You get relaxed, you get detensed, your brain will slow down to where you don't feel like there's a hamster in there running on a wheel and you just can't slow it down and get to bed, or can't gather a thought, especially at work, or you're trying to do like your taxes and you feel like you just have so many things going on. You need to slow that brain down sometimes, lower those norepinephrine levels. The next medication I would like to talk to you about, or class of medications, is dopamine. Dopamine medications or selective dopamine reuptake inhibitors. There's only one medication in that class. It is called Wellbutrin. It can be in an SR form, which is kind of an immediate releasing, excuse me. You give several times a day, or it is on the XL side, which is the long lasting. I do prefer that one better. It minimizes risk of bruxism or grinding your teeth at night, or even sitting around and don't even realize you're doing it. It also minimizes risk of decreasing your seizure threshold or causing seizure issues, which is minimal in of itself. But when you get up to higher doses, it is something to worry about. Dopamine in our brain is involved in our reward pathway. So when things are fun or we feel gratified, that is dopamine being released to our brain to help us feel that way. It is part of treatment of ADHD as well. Adderall, Ritalin, those are two staple medications. They release dopamine in a little bit more amounts to cause dopamine to get to the receptors in the brain. And you would think it would make you more hyperactive. It actually works the opposite. It's a counterintuitive kind of process where it actually lowers your hyperactivity, helps you concentrate. I like to tell people, you ever seen a horse on a parade or at a circus and it has the blinders on? If you take the blinders off, what happens to the horse? Well, the horse gets scared. It flips out, it starts kicking, all these things. ADHD medicines or dopamine-driven medications, Wellbutrin, can be very good for adults for this, and a lot of middle-aged to young adults for ADHD, is it puts those blinders on. So all this outside static, the noise around us, can be driven in to where you focus, but all this other stuff isn't so much in your periphery that it causes you to feel overwhelmed or overexcited. Dopamine, if we break it down by its letters, D, motivation, reward. Again, that's when you do something and you feel gratified or you feel satisfied. That is part of the dopamine process. Dopamine is also in play with psychosis and hallucinations. So hearing or seeing things that aren't there, or dealing with paranoia. Dopamine can play a part in that, whether it's high or low. But that's where that dopamine itself can help fix those kind of issues. There's also Parkinsonism, where decrease in amounts of dopamine is what you will see in patients who have Parkinson issues. Attention is where we need to help increase the dopamine, how much is out there, but we don't want to do that to the point that we're causing you to bite on your shirt or not eat at all, or you feel overstimulated and you're twitching out of nowhere. It can also play effect in our balance of our motor function, and again, that's with the Parkinson part of it. It also helps decrease what is called prolactin in our bloodstream. Prolactin levels can be increased by certain dopamine medications and cause what's called gynecomastia, or male breast development, is the biggest thing that most people know, but that is from too much prolactin in the system. It has a strong role in addiction, and that's a big topic in America today. Meth use is on the rise, and it produces dopamine levels that your body cannot produce without the use of that. And people who have long-term use of methamphetamine will have issues with nothing is fun anymore. Nothing gives them value. Nothing gives them pleasure anymore. They just are going through the motions and are never happy until they have that drug in their system again. That's why they reach to things of stealing from their family, things like that. It really takes away the feeling of pleasure and excitement in life when you have a dopamine released at that amount that we can never replicate. The depression as a whole, now that we've covered the medicines, depression, what it looks like, what it feels like. Depression is when you feel sad, you feel depressed for 2 weeks or more at a time is the definition. Not everybody's always going to fit that definition to that level. Not a lot of people want to admit to fitting that definition to that level. There's still a big stigma around with depression and treatment of it. Remember that it is okay to seek help for treatment with issues with depression and feeling lonely. The generation of 65 and older are the most at risk for trying to commit or successfully committing, suicide, because of family members are passing on, their friends are passing on. They've lost the level of function that they used to carry when they were younger. So when they don't have that level of function anymore, they start to think, especially older gentlemen, start to feel like there's no value in them anymore. They can't take care of their family. They can't do the things they used to do to protect them, to care for them. Depression includes things of sleeping too much or sleeping too little. You can overeat or undereat. I typically see overeating. People want to eat their feelings because they're sad, so they eat to feel better with their comfort foods. You will have issues that we call anhedonia, where you don't have pleasure in things anymore. So if sitting around reading a book or knitting or fishing were things that made you happy, as we deal with depression and as it becomes worse, we have issues of, well, that isn't even fun anymore. So I just want to sit in my chair today, or I'm not going to go golfing with my friends, or I'm going to quit going to my book club because I don't even feel like reading anymore. I don't feel like being around people. Those are all signs that you could be dealing with depression. Not having driven goals. So I'm going to lay around in bed all day. I'm not going to get up and do my chores. I'm not going to take a bath. I'm not going to brush my teeth. When you lack goals, when you start to find excuses for doing things, that is part of abolition, where we're not goal setting, we're not driven anymore. So that can be a sign of depression. Suicidal thoughts is a term that people hear a lot. Suicidal thoughts are dangerous. We don't want anybody to feel like they are alone, that there is no one there for them, that they're going through this struggle alone, because that is not true. There is a lot of people in this world that deal with depression, especially in West Virginia. Again, the taboo of it, of not talking about mental health and not wanting to be involved in that area because it's hard to talk about things. And I'm not a man if I feel this way, or even some women feel that way as well, not just men. Women will come in and say, well, these are my problems, they're not my family's. I have to worry about my family. Well, if we don't take care of ourselves, we can't take care of other people the way we want to if we don't love and take care of ourselves. Part of depression and having suicidal thoughts is not just, I'm going to go home and hurt myself. It can be, I don't care if I wake up tomorrow. I don't care if I get up in a week. I don't care what happens to me. So you might stop taking your other medications because you just don't care anymore. You might start visiting your family. These are all signs that you want to watch out too, because they're not suicidal thoughts, but they're definitely thoughts that could lead to suicidal thoughts if they continue this way. The psychosis that I mentioned earlier is something that you can also have if you're severely, severely depressed. I've had people come in that is depressed and will have issues of hearing or seeing things or feeling paranoid, and it's solely because they are very depressed. There is no mood symptoms involved, no bipolar symptoms or schizophrenia symptoms. It is depression, and it is depression that is the horse that is leading that carriage. And when you figure that out and you start treatment, you can see a big turnaround. But again, there's a lot of medications. Sometimes the first medicine isn't the right medicine, but there will be options out there for you. And that leads me to my next point is, it doesn't have to be medicines. I write medicines for a living. That is what I do. But I'll be the first to tell you that medicines are 35 to 45% of the battle. The rest of it is the people around you, the frame of mind that you have, the environment that you're in. So there's pieces there that can be very, very helpful in the totality of treatment of depression. And it may not even involve medications. I've had several people come in and see me, and my first treatment option for them was, you don't need medicine. You need a good therapist. Therapy can be, imagine you're doing a puzzle on your table. You ever have that one piece you can't find? It's off on the floor, or it's underneath something, or whose where it is. But you find it and you put it in and you finish that puzzle. That could be therapy. Is you were missing that one piece to make you feel whole, to help you deal with something that you had dormant in your mind, that you struggled to get out, that you would peek and try to deal with it, but then you shut the door as soon as the symptoms came back, as soon as those feelings started to rush you again. You ran to your coping skill of pouring it in. I don't want to talk about it. I don't want to deal with it. It's too hard. Therapy can help relieve those things, help you deal with these things that are internal struggles that can help push you to be the person you want to be, and to help you live a quality life, not just a quantity of life. And that's what goal of any treatment should be: quantity. We want you to enjoy the life you have as long as you have it, and to enjoy the family around that you have. Everybody's a book. We all have a cover and a back. When we close that book, which everybody's does, you want the content in between to be the content that you wanted. You want to be able to look back and say, I have no regrets. I lived my life good. I enjoyed it. That help us get help from us if you feel this way, so that we can help you do that. We all get one life. Let's make sure we live it to the fullest. There is options outside of therapy. I've just started a new treatment down here, but I do not want to make it seem like I am just saying this machine, but I use something called TMS from Neurostar. It is a machine that does not require medications. It does 36 treatments of a magnet that sits on your head. It will shoot a magnetic wave down into your brain that helps. And the best way I can describe it is you're rewiring a room in your house so that you can turn the lights on again because that house couldn't get electricity. That is essentially what this medication does at the basic level. It helps open up parts of your brain that was not getting signals, or those neurotransmitters we talked about earlier, the serotonin, norepinephrine, the dopamine. It helps get them back there to where that part of the brain opens up again, and you can experience things or feel things like you haven't in a long time because those parts had been locked off. The wiring had went bad. I've had quite a few 50 and over patients that have went through the TMS machine, and I've not had a one tell me that they regretted doing it, that they did not enjoy the experience because of our staff. They sit with you during it, the time. Everybody has shown improvement, some to different levels than others. I've gotten some off medications completely. I've got some that are coming back in 6 months to do a touch-up session because the studies will tell you that that is needed sometimes, but then they can go a full year, sometimes more, without needing another treatment, but they're not taking any medicines. So, and I've got some that we lowered the medicine because we want to use the safest, most effective dose. So the lower the dose, the less risk of side effects and the less potential of problems. And lowering the dose means the medication could be safer. Necessarily doesn't always mean by doing a TMS that we get you off the medication, but say we get you off one and now that limits your medication profile, but we've lowered another one as well. And even the medication part, the ones that even stayed on it, they felt so much better and so much happier. I had one lady that she went to a wedding and hadn't done that in years. I had another gentleman whose son wrote me a letter that said his dad had improved. He had seen it, that he was grateful that his dad decided to do this. The positive stories are there with this machine. This is where I believe depression and certain psychiatric treatments of anxiety are going. It will be there, I think, very, very soon. I think COVID put a little halt on it, and it's gotten slower. People are a little scared to do it because of the risk of, does COVID come back? You have to come here to do it. But we're taking precautions to make sure everybody wears masks, that it's clean. But there's other options out there, not just a TMS machine. There's several that you can look into. But those are options for people that have liver disease or medications that don't play well with others, or kidney issues or swallowing issues. If you want to try to treat your depression, but you can't take the medications, well, this could be an option. It's also very good for the patients that were treatment resistant. They had tried several medications, have either had adverse effects or never had improvement. This could be an option that leads you to getting successful treatment, but without having to worry about the side effects of the medications, taking the regimen, making sure you remember to take them. There's several options out there for you if you are willing to ask for help, seek the treatment, and listen to what people have to say, but they need to listen to you too, to make sure that you're getting the treatment you want, you're getting the service you want, and you're getting the quality of care that you need and deserve. The last thing I would like to say is that remember, treating mental health issues is difficult. No one wants to admit to it, to talk about it, but it is a thing in our society. It is an issue that needs to be fixed. There are people out there that love you, and would love to help you if you would allow us to do that. Don't ever think you're in this alone. There is multiple people in this world that is there for you, to help you. All you have to do is come to us and let us try. So I thank you for letting me talk to you today. If you have any questions at all, you can contact me at the Counseling House. Telephone number is 1-304-865-5444. Our fax is 1-304-865-5445. We have a website that is up, or if you do not even want to seek our assistance, please seek someone out. whether it be your primary care doctor, whether it be a friend that can help talk you into seeking therapy, because maybe that's the door we need to open, and it's not medication wise. We do offer all these services here with therapy, me for med management, and the TMS machine. So if you guys have any questions, please contact me. But remember, people love you. Don't do this alone, and we're here for you. Thank you, guys.